Welcome to another edition of the Ministry of Health's Weekend Review. On Wednesday, March 13th, Minister of Health Honorable Dr. Frank Anthony met with a team from the Roche to discuss a comprehensive breast cancer screening program. The team provided valuable insights into the latest methodologies for detecting breast cancer at an early stage. On the said day, the minister presented the Georgian Public Hospital Corporation with a certificate of designation in recognition of being a kidney transplant center in Guyana. This health facility was the first in Guyana to receive this award. It was presented to them through the Guyana Human Organ and Tissue Transplant Agency. In congratulating the hospital for their major achievement, Dr. Anthony noted that since the establishment of the agency, the work done in a short period has pushed the barriers to be able to have good transplant practices in Guyana. He further added that the ministry is exploring partnerships with overseas companies to provide training in different areas of transplant.
We also recognize that while there's a lot of enthusiasm for us to do different types of transplants, that we have to look at the cadre of people that we have and train them in various areas. And we have been exploring partnerships with Spain. You heard some of the persons who have gone on training, but also we are exploring a lot of possibilities of sending people across to Brazil for training. And I think a combination of training people in different jurisdictions would allow us to build an even stronger program.
In closing, Minister Anthony stated that very soon, Guyana will have a biobank established.
The legislation also contemplates some other things that we'll be working on this year. One of which is to develop a biobank, and that is stipulated in the legislation. So we've started various conversations in the development of a biobank, and hopefully in the not so distant future that we'll be able to put or make a biobank in Guyana.
Meanwhile, on Thursday, the Guyana Global Fund Country Coordinating Mechanism hosted a country dialogue on the HIV/AIDS tuberculosis program at the Ministry of Health's conference room located at its Brickdam headquarters. This dialogue was an open, inclusive, and participatory process that includes implementers from the public sector, the private sector, civil society, academia, networks of key affected populations including women organizations, people most vulnerable, including people living with the disease, bilateral, multilateral, and technical partners, and other key stakeholders. During his remarks, Minister Anthony emphasized the importance of achieving virus suppression once treatment begins for HIV. He highlighted the recent purchase of a new equipment valued at approximately $5,000 and the implementation of viral load tested at the National Public Health Reference Lab. He also noted that it's important to focus on the core elements of the program, ensuring patients have access to testing and ARVs. This week, Guyana joined with its international community to observe World Kidney Day. The Ministry of Health used this opportunity to sensitize the public on chronic kidney diseases. You can access these education videos and posters on our social media platforms. This wraps up our weekend review. Until next time, stay safe and protected.